Uh-huh. Have a seat. Your name?
Lorraine.
Lorraine. Tell everybody, Lorraine, in 30 seconds why you're up here on the table.
In 1971, I was thrown out of the front windshield of a vehicle. I was never treated. In 1992, I was in a car accident, which to this day I'm not a great passenger, even though I was a driver of that car. And last year, I was knocked by a truck off my bicycle into a wall. My helmet's cracked, and I had a fractured radial head on the left, and metatarsal, first metacarpal head on the right.
She's the kind of patient that you dread getting just before lunch. Who gives you that history because you know you're going to miss lunch?
I have no pain. I just have, if someone touches my spine, I'm very sore.
Okay.
And Easter
So
Sunday,
how will we know if you're better? Just by that?
Yeah.
Okay, that's
Yeah.
fair. Okay, good. Lie down. Now, I would tell you right away, she's probably a fairly tough lady. Were you a tomboy when you grew up?
I think so.
We don't talk enough about this, but when you query women, it's really important to find out if they were tomboys, if they really liked activity and they thrived on it and they're tough, because she's had a lot of trauma and she doesn't sound like she's in much pain, which is pretty good for what she's been through. So that's pretty good. It's good for you. Okay, so let's go through and see what we find. And here we go. Left side pelvis, you feel this here? Yeah. Compared to the right side.
Oh, yeah.
Feel the difference? Mm-hmm. Same pressure. Doesn't feel like it's possible, does it? Coccyx is okay on you. Lower lumbar, a little bit on the left, not too bad. Not too bad on the ribs. Diaphragm looks okay. She's got a little bit right side more than left, infraspinatus teres minor. T-spine on the right, upper T. Do you feel this here? Mm-hmm. Pretty tender compared to here? Mm-hmm. Okay. Cervical thoracic junction?
Oh, yeah.
Yeah, okay. Mm-hmm. How about ligamentum nuchae on the right compared to the left?
Oh, yeah.
Here, suboccipital on the right?
Yeah.
Compared to the left?
Oh, yeah.
Big difference?
Oh, uh-huh.
Okay. How about here on the right?
Uh-huh.
Okay. Here?
Yes.
Compared to here?
Yes.
Sphenoid? Okay, so she has kind of more areas than she thought she had that were involved. So let's see what we can do to correct some of these. Eyes closed for me.
Mm-hmm.
What area is that correcting when you do that?
This is going to correct anything that's related to the startle reflex. If you heard her history, she's been startled a few times from the trauma she's had. Okay, this is an abbreviated version of what I call the startleless reflex, which takes a little bit more time to do. But this corrects a lot of that without even having to get into that. Because if you realize it, if you say to people, have you ever had this done to you before? The answer will be no. Nobody's ever had any of this stuff done to them before. So this is all new to the nervous system when they have this done. I'm covering an extra base here just because she's had so much trauma throughout her body. Normally I just treat on the side of involvement. Usually that's the right side. I'm just throwing a little extra on her. Sorry?
No problem throwing in extra. Does it confuse things?
No, it seems to help, but I shouldn't have done it because I don't do it that often. I'm just doing it here because I don't have that much time. I'm having to hurry through things. Normally I would take a little longer to go through and do things, so I'm trying to do shortcuts here. Remember, I don't treat patients in 5 minutes even in my clinic.
Well, I know, but even if we were to do it bilaterally on our own,
There's no harm in doing it. But if it's not a bilateral issue, you're probably not going to get much benefit doing it on the opposite side if there's no findings there, and there really weren't many findings, virtually no findings on the left side. Good question, good observation on your part. Okay, don't let me push down this way. Okay, you ready? You ready? Mm-hmm. You see that? You see people do that. They get ready. And so when they think they're ready, then you have to trick them so they get confused as to where you're coming from. Okay. What's that feel like now?
Much better.
Much better, she just said. Okay, now we need to down-regulate her here because she's still got some big knots in her rotator cuff. Do you remember the technique we did, thumbs touching hands, crossover? Hold that. Hold here, don't let me turn. Now let go, good, relax here, good. Okay, here we go. Now I am going to really PA her, stress her T-spine. How's that feel?
Wonderful.
Tell them, louder.
Wonderful.
Now, you'd have to appreciate that this did not want to move before. This was pretty rigid. And now I can feel the yield as I'm moving up, going from about 5 up to T1. And she can tell, and I can tell that there's a big difference there now.
Yeah, it's
Isn't there?
Oh, it's huge. Oh.
Cervical thoracic junction, she just made a nice little sound there of relief. People make some cooing sounds when you do this work. Yeah, it's nice. Feel the difference here?
Oh, yes.
Remember that?
Oh, yes.
Yeah. And if she's a tomboy, if that's her circuitry, she's going to respond so nicely to this work. Athletes respond nicely to this work. Not that other people don't, but if somebody was gifted in the way their body was put together, they respond much faster to this. That's why we treat a lot of professional athletes, and they're usually 1 or 2 sessions and they're done, even if they've had chronic problems.
Oh.
Feel the difference up here?
Oh, yes.
Yeah. Lift your shoulders just a little bit. Now let go. Let me have your arms here. Hold them here. Don't let me push up. Don't let me push. Now let go. Good. Relax there. Check that out. Hmm?
Yeah.
You'll sleep tonight, won't you?
Oh, yeah. Thanks.
Feel these? Feel these now?
Listen still a little bit, but so much less than it was.
Here, I'll fix that for you. There you go. Hmm?
Yeah.
Bend a little bit. Bend a little bit. Put him down. Put it down. Want to sit up? How you feel?
Yeah. This is lovely.
Okay. You're welcome. We get a lot of people on the first visit that have an endogenous opiate release, so they feel like they're kind of floating. And in acupuncture, that's a very good sign for somebody to have that. The only problem is you got to tell patients sit in the reception area for a little while. You don't want to get in the car and drive, because if you feel like you're kind of floating, not safe to be behind the wheel. Usually that clears in 10-15 minutes, but many people have a profound effect just on the first visit. We know we're tapping into a very powerful system when we're getting that response with an endorphin response.